What exactly is dementia? Dementia is not a single disease but an umbrella term for symptoms affecting memory, thinking, and social abilities. It's caused by damage to brain cells, which disrupts their ability to communicate. Imagine your brain as a network of interconnected pathways, each carrying vital information. Dementia disrupts these pathways, causing confusion, forgetfulness, and difficulty managing daily tasks. While age is a major risk factor, dementia is not an inevitable part of getting older. Most older adults never develop dementia. However, understanding its causes and symptoms is critical for early diagnosis and intervention. The 4 most common types of dementia. Dementia is not a one-size-fits-all condition. It manifests in various forms, each with unique symptoms, causes, and progression patterns. Among these, 4 types stand out due to their prevalence and distinct characteristics. Understanding these types is vital for accurate diagnosis, tailored treatment, and effective caregiving. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of all cases. It begins subtly, often with symptoms that resemble typical aging. These early signs include memory lapses such as forgetting recently learned information, misplacing everyday items, or struggling to recall appointments. As the disease progresses, these memory challenges intensify, and other symptoms emerge. People with Alzheimer's may have trouble completing tasks that require planning, like following a recipe, and may forget familiar routes or faces. What sets Alzheimer's apart is the physical changes in the brain caused by the buildup of 2 abnormal proteins, amyloid plaques and tau tangles. Amyloid plaques disrupt cell communication, while tau tangles impair the transport of nutrients within brain cells, leading to their death. This damage typically starts in the hippocampus, the brain's memory center, and gradually spreads to other areas, affecting language, reasoning, and even personality. Though there is no cure for Alzheimer's, early intervention can help manage symptoms. Medications such as cholinesterase inhibitors can improve memory and cognitive function temporarily. Non-pharmacological approaches, like cognitive stimulation therapies and a structured daily routine, are also critical in maintaining quality of life for individuals with Alzheimer's and their caregivers. Vascular dementia is the second most common form of dementia, accounting for 10 to 20% of cases. Unlike Alzheimer's, it is directly linked to issues with blood flow in the brain. These problems often result from strokes, mini-strokes, transient ischemic attacks, or chronic conditions like high blood pressure and diabetes. The symptoms of vascular dementia can appear suddenly, particularly after a stroke, or develop gradually if caused by long-term circulatory issues. One of the hallmarks of vascular dementia is difficulty with executive functions such as planning, organizing, or making decisions. People may also experience slowed thinking, difficulty concentrating, or mood changes like depression or apathy. Memory problems are present but may not be as severe as in Alzheimer's during the early stages. Vascular dementia often progresses in a stepwise manner, meaning symptoms worsen suddenly after additional strokes or vascular events. Managing risk factors such as hypertension and high cholesterol is crucial to slowing the progression. Treatment focuses on preventing further brain damage through lifestyle modifications, medications to improve blood flow, and therapies to enhance cognitive function. Lewy body dementia, LBD, is less common but uniquely complex, accounting for about 5 to 10% of dementia cases. It is named after the abnormal protein deposits, called Lewy bodies, that develop in the brain and interfere with the communication between brain cells. LBD shares symptoms with both Alzheimer's and Parkinson's disease, which can make diagnosis challenging. Early signs of LBD include cognitive fluctuations, where a person's alertness and coherence may vary dramatically from one moment to the next. Another hallmark symptom is visual hallucinations, which can be vivid and distressing. These hallucinations often involve seeing people, animals, or objects that aren't there. Additionally, people with LBD frequently experience sleep disturbances, such as acting out dreams, REM sleep behavior disorder, and motor symptoms like tremors, stiffness, or a shuffling gait, similar to Parkinson's disease. As the disease progresses, cognitive decline becomes more consistent, and behavioral symptoms like anxiety, paranoia, and delusions may emerge. Autonomic dysfunction, which affects heart rate, blood pressure, and digestion, is also common in later stages. Treatment for LBD involves a combination of medications and supportive therapies. However, managing symptoms can be tricky, as certain drugs effective for other dementias or Parkinson's may worsen LBD symptoms. a careful and individualized approach is essential. Frontotemporal dementia, FTD. Frontotemporal dementia, FTD, is a group of disorders that primarily affect the frontal and temporal lobes of the brain, areas responsible for personality, behavior, and language. Unlike Alzheimer's and vascular dementia, FTD often occurs in younger individuals, typically between the ages of 45 and 65, making it a significant cause of early onset dementia. Early symptoms of FTD are strikingly different from those of other dementias. Instead of memory loss, the first signs are often behavioral or emotional changes. A person with FTD might display uncharacteristic behavior, such as acting impulsively, showing a lack of empathy, or engaging in socially inappropriate actions. Emotional blunting, where they appear indifferent to situations that would normally elicit a strong response, is also common. In other cases, language difficulties dominate, with individuals struggling to find words, form coherent sentences, or understand speech. FTD progresses rapidly compared to other types of dementia, with symptoms worsening over a few years. Repetitive or compulsive behaviors, loss of judgment, and even physical difficulties like swallowing or mobility issues can develop in advanced stages. The exact cause of FTD is not always clear, but genetic factors play a significant role in some cases. There is currently no cure for FTD, and treatment focuses on managing symptoms. Behavioral therapies can help mitigate impulsivity and social difficulties, while speech therapy supports communication. Antidepressants or antipsychotic medications may be used cautiously to manage mood or behavioral symptoms. Understanding these four types of dementia provides a clearer picture of how they affect individuals differently. This knowledge is crucial for recognizing symptoms, seeking early diagnosis, and tailoring treatment plans to improve outcomes. If you or someone you know is experiencing any of these symptoms, don't hesitate to seek professional advice, it could make all the difference. 9 Early signs of dementia. Recognizing the early signs of dementia can make a significant difference in the lives of those affected. These symptoms may start subtly, often dismissed as stress, distraction, or normal aging. However, they signal underlying changes in brain function that should not be ignored. Let's explore each sign in depth. 1. Struggling with words. One of the earliest and most noticeable signs of dementia is difficulty finding the right words during conversations. At first, it might appear as an occasional pause while searching for a term or substituting a vague word like thing instead of a specific name. Over time, these language struggles become more frequent and noticeable. A person may frequently use incorrect words, confuse names of familiar objects, or rely heavily on gestures to communicate. For example, they might point at a pen and say, "That's the writing thing." These challenges often lead to frustration for the individual and their loved ones, as communication becomes strained. The inability to express oneself clearly can cause social withdrawal, as individuals may avoid conversations to prevent embarrassment. Language difficulties are a key indicator of cognitive decline and should prompt a medical evaluation. 2. Changes in sensory perception. Dementia doesn't just affect memory and cognition, it can also alter the way a person perceives the world through their senses. These changes might include difficulty recognizing faces, misjudging distances, or struggling with depth perception. For example, they might not recognize a close friend or might trip over objects because they can't accurately judge their position. Other sensory changes can include diminished taste or smell. Foods that were once favorites may lose their appeal, leading to reduced appetite or poor nutrition. These sensory disruptions can also impact emotional well-being, as the world becomes less familiar and predictable. Visual or auditory processing issues can make everyday activities like reading, watching TV, or following conversations more challenging. These changes, while subtle at first, can profoundly affect a person's ability to navigate their environment and engage with others. 3. Loss of motivation. Apathy, or a loss of interest in activities and hobbies once enjoyed, is a common but often overlooked early sign of dementia. It's easy to confuse this with depression, but apathy in dementia is different. It lacks the feelings of sadness or despair typical of depression. The person may stop participating in social events, hobbies, or even routine activities like cooking or gardening. They might spend hours sitting quietly, disengaged from their surroundings, or avoid initiating tasks altogether. This lack of motivation can extend to self-care, leading to neglect of personal hygiene or household chores. Over time, apathy can erode relationships, as loved ones may misinterpret it as laziness or indifference. Recognizing apathy as a potential sign of cognitive decline is crucial for ensuring the person receives appropriate support. 4. Muscle weakness and coordination issues. Dementia can affect not only the mind but also the body, causing unexpected physical symptoms such as muscle weakness and poor coordination. These issues may manifest as difficulty performing fine motor tasks like buttoning a shirt, brushing teeth, or using utensils. For example, someone might struggle to pour a drink without spilling or find it challenging to tie their shoes. They may also experience frequent falls, unsteadiness while walking, or difficulty maintaining balance. These motor issues are particularly common in conditions like vascular dementia or Lewy body dementia. Physical changes may precede other cognitive symptoms, making them an important early indicator. Addressing these challenges through physical therapy and assistive devices can help maintain independence and reduce the risk of injury. 5. Getting lost in familiar places. Spatial disorientation is one of the hallmark signs of early dementia. A person may suddenly struggle to navigate familiar environments, such as their neighborhood or even their own home. For instance, they might leave for a routine walk and be unable to find their way back. Inside the house, they may become confused about the layout, forgetting where rooms or commonly used items are located. This loss of spatial awareness is not only disorienting but also distressing, as it undermines the individual's sense of independence. This symptom can lead to dangerous situations, such as wandering away from home or becoming lost in public spaces. Early intervention is crucial to ensure safety and provide the necessary support systems. 6. Sleep disturbances. Changes in sleep patterns are another common early sign of dementia. A person might experience difficulty falling asleep, frequent awakenings during the night, or excessive drowsiness during the day. These disruptions are not just inconvenient, they can exacerbate cognitive decline and mood issues. One particular phenomenon, known as sundowning, is often observed in dementia patients. It involves increased confusion, agitation, and restlessness during the late afternoon or evening. This pattern can disrupt not only the individual's routine but also the lives of their caregivers. Sleep disturbances can be managed with a structured bedtime routine, exposure to natural light during the day, and, in some cases, medication. Ensuring quality sleep is essential for supporting overall cognitive health. 7. Postural changes and walking difficulties. Subtle changes in posture and walking patterns can signal early stage dementia, particularly in conditions like Lewy body dementia and vascular dementia. The person may develop a hunched posture, stiffness in their muscles, or a shuffling gait. These changes may be accompanied by hesitation before initiating movement or an unsteady walk that increases the risk of falls. Over time, these mobility issues can become more pronounced, limiting the person's ability to engage in physical activities and reducing their independence. Early recognition of these signs can prompt interventions such as physical therapy, which can help improve balance and mobility, prolonging the individual's ability to move independently. 8. Simple tasks becoming overwhelming. Everyday tasks that once required little thought can suddenly feel complex and overwhelming. For instance, preparing a simple meal might become an insurmountable challenge. A person might forget the order of steps, leave ingredients out, or abandon the task midway. This difficulty extends to other routine activities like paying bills, operating household appliances, or even dressing. For example, they might put clothes on in the wrong order or forget how to use familiar items like a microwave. These challenges are not only frustrating but also disheartening, as they erode the person's sense of competence and independence. Recognizing and addressing these struggles early can help provide the necessary support and accommodations. 9. Social withdrawal. When someone begins to avoid social interactions or withdraw from conversations, it's often a sign that they are struggling with cognitive decline. This withdrawal might stem from embarrassment about memory lapses, difficulty following conversations, or a loss of confidence in their communication skills. For example, a once outgoing individual might stop attending family gatherings or decline invitations from friends. They may become unusually quiet during group interactions, fearing they might say something inappropriate or forget what they were discussing. This social withdrawal can lead to isolation, which, in turn, accelerates cognitive decline and impacts emotional well-being. Encouraging gentle social engagement and creating a supportive environment can help mitigate these effects. Steps to maintain brain health. While there is no guaranteed way to prevent dementia, scientific evidence shows that adopting a brain-healthy lifestyle can significantly lower your risk. These proactive steps not only benefit cognitive function but also contribute to overall physical and emotional well-being. Let's delve into these strategies. 1. Healthy diet. Nourishing your brain. What you eat directly impacts your brain's health. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as the Mediterranean or DASH diets, has been shown to reduce the risk of cognitive decline. These diets emphasize foods that are high in antioxidants, vitamins, and omega-3 fatty acids, which combat inflammation and oxidative stress, two factors linked to dementia. Key nutrients like vitamin E, vitamin D, and omega-3 fatty acids found in fish, nuts, seeds, and leafy greens support brain cell health and protect against neurodegeneration. Foods like blueberries, often called brain berries, contain flavonoids that improve memory and delay cognitive aging. Limiting processed foods, sugary drinks, and trans fats is equally important, as these can lead to inflammation and poor vascular health, which are risk factors for dementia. Making small, consistent changes, like swapping chips for nuts or adding a serving of vegetables to every meal, can have a profound impact on long-term brain health. 2. Exercise. Fueling the brain with blood flow. Regular physical activity is one of the most effective ways to boost brain health. Exercise increases blood flow to the brain, delivering oxygen and essential nutrients that support neural function. Activities like walking, cycling, swimming, or yoga can stimulate the release of brain-derived neurotrophic factor, BDNF, a protein that promotes the growth of new neurons and strengthens existing connections. Even moderate exercise, such as a 30-minute brisk walk 5 times a week, can significantly reduce the risk of developing dementia. Studies show that consistent physical activity not only improves memory and executive function but also slows the progression of cognitive decline in those already experiencing mild symptoms. For those who may find structured exercise challenging, everyday activities like gardening, dancing, or even playing with pets can also provide substantial benefits. The key is to stay active and find joy in movement. 3. Cognitive engagement. Keeping your brain active. Just like a muscle, your brain thrives on use. Engaging in mentally stimulating activities helps build cognitive reserves, providing resilience against the effects of aging and neurodegenerative diseases. Activities like solving puzzles, playing strategy games, learning a new language, or picking up a musical instrument challenge your brain in novel ways, encouraging the growth of new neural pathways. Reading, writing, and even participating in creative hobbies like painting or crafting are excellent ways to keep your brain sharp. The idea is to continually learn and challenge yourself. For example, if you enjoy crossword puzzles, try increasing the difficulty level over time. If you love cooking, experiment with cuisines you've never tried before. These activities not only enhance mental agility but also provide a sense of accomplishment and purpose. 4. Social interaction. The power of connection. Human beings are inherently social creatures, and maintaining meaningful connections is vital for brain health. Social interactions stimulate cognitive processes like memory, attention, and emotional regulation. Spending time with friends, family, or participating in group activities reduces stress, combats loneliness, and enhances overall mental well-being. Research shows that people who maintain active social lives are at a lower risk of developing dementia. This is because conversations and interactions require your brain to process information, respond, and adapt in real time, all of which help keep your mind engaged. If you feel isolated, consider joining a community group, volunteering, or even attending classes to meet like-minded individuals. In today's digital age, staying connected through video calls, social media, or online communities can also provide meaningful engagement. Hope on the horizon. The fight against dementia is far from over, but advancements in research are offering new hope. Scientists are making significant strides in understanding the mechanisms of neurodegenerative diseases, paving the way for innovative treatments and therapies. One area of focus is the development of medications that target the underlying causes of dementia. For example, drugs aimed at reducing amyloid plaques and tau tangles in Alzheimer's disease are being tested in clinical trials. Immunotherapies, which use the body's immune system to attack harmful proteins, are also showing promise. Non-pharmacological therapies, such as brain stimulation techniques and personalized cognitive training programs, are gaining traction for their ability to improve quality of life and slow disease progression. Additionally, wearable devices and AI-based tools are being developed to detect early signs of dementia, enabling earlier intervention and better management. The importance of early diagnosis cannot be overstated. Identifying dementia in its earliest stages opens the door to clinical trials, experimental treatments, and lifestyle adjustments that can significantly alter the course of the disease. Your next step. Knowledge is power, and understanding dementia's early warning signs is just the beginning of your health journey. By taking proactive steps toward brain health, You're not only reducing your risk of dementia but also enhancing your overall quality of life. But your journey doesn't stop here. There's so much more to learn about protecting your health and recognizing critical symptoms of other conditions. To continue building your awareness, we invite you to watch our next video, Never Miss These 8 Early Signs of Prostate Cancer. This video explores potentially life-saving insights that every individual should know. Together, let's take charge of our health, support one another, and create a future where knowledge leads to empowerment and action. Click the link below to watch the video and stay informed about the steps you can take to live a healthier, longer life.